I'm Dr. Lindsay Davis. I'm joined today with Mary Williams, one of our nutritionists, and then Dorothy, one of our chefs at Vetri, who's also a registered dietitian as well. Correct, Dorothy? Great. And so today we're going to be talking about understanding and eating well in pregnancy. So I am going to share my screen with you. And as our housekeeping, just general things for today, that we are going to be recording this session. So feel free, if you want to keep yourself not on video camera, you can go ahead and just be able to take yourself off. If there's any questions, you can certainly put that in the chat, but if you don't want any of that to appear, you can always directly message me through Zoom. And then I would also ask, we do like to keep attendance of who has joined us, because afterwards we will send out, everybody should have received this recipe already with the registration, but we'll also send out our PowerPoint slide set. And we just like to give that to those who have attended the session rather than everybody who has registered. Some people, their screen names on Zoom might not link up with what you had registered as. So if you have something that a different name than what you had registered as through our system, please just directly message me with what your email address is so that we can make sure to get all of those slides and information to you after the presentation. So thank you everybody for joining us today. So let me go ahead and we will share my screen. I'll give that just a moment to pop up. From the beginning. Okay, lovely. So today we are talking about understanding and eating well for pregnancy. We will have just a general overview of what types of changes our body goes through in pregnancy, what sorts of nutrients we need, and then we'll have a food demonstration to be able to bring all of those lessons into practice. So big things that we'll be discussing is how our body changes during pregnancy, what sorts of hormonal changes there are, what nutrients do we need, what certain foods should we be avoiding, and what would be healthy weight gain. And then we'll talk about common pregnancy symptoms and lifestyle modifications that we can make to help with some of those symptoms. So first off are our hormonal changes in pregnancy. HCG, or the human gonadotropin, chorionic gonadotropin hormone, is going to be what is released by the pregnancy tissue. It hits its highest peak around 8 to 10 weeks of pregnancy, and is thought to be the main cause of that nausea in pregnancy. And so therefore, just knowing that a lot of pregnant women, that nausea does have a tendency to get better as we get further into pregnancy and certainly past the first trimester. It can also, that hormone can cause tiredness, irritability, bloating. So all of those common first trimester symptoms are normal. Things like estrogen is a female sex hormone. It is increased by up to 30 times the amount our body typically sees prior to pregnancy versus in pregnancy. It can cause headaches and nausea. It can also make us more prone to things like blood clots, where our blood could clot in our legs and then that clot could travel elsewhere to our body. So just knowing that there's reasons why we feel more achy, but why it's also really important to stay moving and stay active in pregnancy because of those high estrogen levels. And then progesterone is our other female sex hormone. And again, things that our body's exposed to prior to pregnancy, but really markedly increased levels during pregnancy. And it is responsible for causing that increased appetite, bloating, and heartburn. So morning sickness. Now, everybody's heard of morning sickness, but to be honest, nausea in pregnancy is not strictly isolated to the morning. Everybody has different symptoms that they might experience. Some women don't experience symptoms of nausea, and that can be okay and normal, but up to about 75% of women will experience some degree of nausea in pregnancy. It's the most common in the first trimester. As we said, it typically gets better as we get further along. Things that can be helpful are adding a vitamin B6 supplement, and usually breaking that up 3 times a day into small dosings, about 10 to 25 milligrams. We don't want to take more than 100 milligrams, can actually have an adverse impact, but that's one just very simple intervention that can be helpful. We talk about hyperemesis gravidarum is when there is extreme nausea and vomiting in pregnancy that's contributing to significant weight loss and might require not only anti-nausea medication, but also hospitalization in some cases.
So the good news is there are many foods that you can have during your pregnancy, but we do want to highlight some of the things that you want to avoid. And a couple of them are listed, things like cold cuts, hot dogs, lunch meats. These types of foods can contain listeria and nitrates, which you see with sodium and fat. Be careful of pre-stuffed and fresh chicken or turkey, raw meat, and be careful when you bring the raw meat home how you handle it. We want to avoid rare and undercooked meat because of possibility of bacteria. Watch out for refrigerated pâtés and meat spreads. Not a lot of people eat them today, but they are out there. Fish is a common thing. We want to be very careful of high mercury containing fish, which is found in smoked fish and raw fish, mackerel particularly, shark and swordfish and tilefish. Smoked fish is unsafe unless you cook it after it's been smoked. Raw fish and raw shellfish like oysters, sushi, clams, mussels should also be avoided. Dairy. So you may have questions about dairy. Dairy in general is good. However, we want to be careful of raw eggs due to salmonella, unpasteurized or raw milks, cheeses made with raw milk. Eggs are safe when they are cooked, but eggs and foods made with raw eggs should be avoided, like a real Caesar homemade salad dressing, homemade mayonnaise, hollandaise sauce. Some mousses, meringues, or tiramisu may have raw eggs. Unpasteurized or raw milk and cheeses made from unpasteurized milk are not considered safe for pregnant women and their baby. Soft cheeses are more likely than hard cheeses to be made with unpasteurized milk, but you should always check the label to be sure. Some examples of cheeses made with unpasteurized milk, like we mentioned, were the brie, the feta, queso blanca, queso fresco. So what other foods should we avoid? And we want to talk about alcohol. Alcohol enters the baby's bloodstream in the same concentration that it enters your bloodstream, and it takes twice as long to leave it. So think of you as an adult, how big you are in your body weight, and think of that little tiny baby that's developing. Just think about whatever you're drinking, your baby is drinking it too. So we advise you to avoid alcohol. Also, caffeine. We want you to kind of keep a limit on caffeine. Think of what it does to us. It keeps us super awake. It can speed up the heart rate. So we do want you to limit your caffeine to about 1 12-ounce coffee per day. Fruits and vegetables. Best way to make sure they're safe is to wash your hands really well, clean your area and utensils. Make sure that you're not cutting your fruits and vegetables on a cutting board that you've cut meat on. Try to use clean, cold water. Vegetable brush is really good. Soaking the fruits and vegetables is good. dry with a clean paper towel. So if I have the cantaloupe, which can be suspect, think of where it's been before you got it, and I take a clean knife and I cut it into the cantaloupe. If the cantaloupe, the outside of the cantaloupe is dirty, I'm now transmitting it into the middle of the cantaloupe. So there is chance of bacteria. Someone asked about the alcohol and vanilla extract. When you cook it, does it bake off? Yes, it does. So you are okay using that.
Okay, great. Thanks, Mary. And so one of the things that we mentioned is wanting to avoid things like deli meats and unpasteurized cheeses, making sure that we're washing all of our fruits and vegetables very well. And one of the primary causes, aside from just avoiding other foodborne illnesses, things that can cause a GI upset, but things like listeria is a bacteria that's found in soil, water, and can survive in colder temperatures. So even things like ice cream, something that's frozen, sometimes that there can be a listeria contamination. So being able to be aware of where that can occur, being able to, be in tune if there is a listeria outbreak, and why we recommend avoiding those foods that can be more prone to listeria is because it can cause things like preterm labor, a miscarriage, or stillbirth. Luckily, that we don't have that many cases of an outbreak, and with cognizant eating can be very, making sure that we're staying safe and keeping our babies safe. So things that we can do to help to decrease any risk of foodborne illness is keeping a refrigerator at a low temperature before 40 degrees Fahrenheit, keeping our freezer below 0 degrees Fahrenheit, making sure that we're thawing food safely, usually doing that in the refrigerator. If we're leaving it out at room temperature, only doing that for 2 to 3 hours. That we don't want to leave perishable food at room temperature for more than typically 2 to 3 hours, and that we are refrigerating eggs. And so we say we're eating for 2, but we're not eating twice as much. So how much extra calories do we need? On average, that's about 300 calories per day that a pregnant woman needs to grow a baby adequately. In the first trimester, it's very little change, that our appetite might be off, we might not feel as hungry, and that's okay, that we don't need a lot of extra calories. In the second trimester, about 340 calories per day. By the third trimester, up to 452 calories per day. And with breastfeeding, we still need just as much increased caloric intake for being able to continue giving the baby adequate nutrients and milk supply, so that our appetite isn't necessarily going to go down after delivery. And what is healthy weight gain in pregnancy? Well, that depends on what your starting weight is. If we're at a normal weight, about 25 to 35 pounds is recommended. If we're already slightly overweight, then 15 to 25 pounds. And then if we're underweight, 28 to 40 pounds. And where does all of that weight go? Well, full-term babies on average are going to be about 7 to 8 pounds. The uterus and the placenta and the fluid around that is going to be an additional 6 pounds. About 2 pounds that go to the breast tissue and milk production, 4 pounds attributed to increased blood supply, and about 11 pounds of increased water weight and fat. So the nutrients that we need for a healthy pregnancy.
Okay, so you may have heard a lot about folic acid. It's very important for to prevent spina bifida. It helps your body build its spine, its brain, its skull. It's very important in the early stages of pregnancy, or if you're planning to become pregnant. The recommended amount is 400 micrograms of folic acid daily. And you want to start at least a month before pregnancy if you do know. And if you're a good planner, not everyone's that lucky. are you high risk? And your doctor might advise you to do something like take 4,000 micrograms of folic acid daily. That's something to discuss with your doctor. Because the spine, the brain, and the skull begin development in the early stages of pregnancy, it can occur before you even know you're pregnant yet. This is why we recommend that all women who are planning on becoming pregnant take 400 micrograms daily. If you're planning to become pregnant, we say start about a month before. Okay. And so other important nutrients in pregnancy are protein. Protein's going to be found in, it can be found in beans, lean proteins, chicken, turkey, fish, beef. And so protein is going to be very important to rebuild cells, for cells to grow. So you're going to need maybe a little bit more protein than you did beforehand. Iron is going to be very important also. Iron will help your body carry the oxygen you and your baby need through the body. Your body needs about 27 grams of iron each day while you're pregnant. And a lot of that you're going to receive through your prenatal vitamin. Calcium is needed for bones and changes for your hormones. Your body can only take in about 600 milligrams of calcium at a time. And certainly you can take up to 2,500 milligrams a day. Calcium is generally found in your dairy products. There are fortified items like orange juice that has calcium. Things like almond milk have fortified calcium. There are other sources of calcium that are out there. And omega-3 fatty acids, about 300 milligrams a day. And omega-3 fatty acids help improve your immune system. They help prevent cardiovascular disease. And your immune system is the body's defense system that helps fight infection by attacking germs that cause disease. It will also, fat in your body also helps grow your body's brain, the baby's brain. Your brain's grown. And so great ideas. How do you get the nutrients you need? Fish is a great source of healthy fats. You should eat about 2 to 3 servings of cooked fish per week. Try to get a lot of variety and try to avoid those fishes that we mentioned before, the swordfish, the tilefish that are high in mercury. And the ones that are going to be safe to eat, anchovy, some of these you may not see that often. Cod is easily obtainable, so is crab, flounder, salmon, scallops you see, sardines you see, these fish. We would suggest 2 to 3 servings a week. Again, they have healthy fats needed for the baby's brain development. Other foods and nutrients you need. Fruits are really great because it gives you fiber. It does help with blood sugar levels. It helps with fullness. It helps give you vitamins and minerals. Same thing with vegetables. Most people do not eat enough fruits and vegetables daily. There are so many benefits just from a health standpoint. And for anyone who has had gestational diabetes in the past, or anyone in our group that has diabetes, fiber does help lower blood sugar levels. We are going to suggest with fruit that you choose fresh fruit. If you get canned fruit, get it packed in natural juice or water. If you do frozen fruit, make sure there's no added sugar. Vegetables, fresh or frozen, are going to be good. If you need to use canned, try to use low sodium. And try to get vegetables that don't have a lot of sauces that would have salt. So, for example, like a soy teriyaki vegetable has a lot of added salt to it. And then other nutrients that are really good to have are going to be whole grains. Again, whole grains have fiber, which we mentioned was important. So something like a slice of whole wheat bread, half a cup of whole grain cereal, half a cup of brown rice, half a cup of whole grain pasta would be considered to be some servings of whole grains. And then protein, for most of us, you want to eat at least palm size, not counting your fingers, maybe a little bit bigger. So when you're not pregnant, that would be the perfect amount. And so here's my little 3-ounce fish. This is a flounder. So when you're pregnant, you certainly could eat a little bit more than this. So that would be a good serving, palm size at your meal, at least. Choose those lean proteins, fish that are low in mercury. Don't use skin with poultry, with chicken or turkey with skin. Low-fat milk products are great, and beans and lentils are really good source of protein. Dairy, we recommend 3 cups per day. Each cup of milk has about 300 milligrams of calcium per day, but you also can, like we mentioned before, can get calcium from other sources. Yogurt, cheese are good sources of calcium. And remember that your prenatals are so important because they do have these extra nutrients that you need during pregnancy. And so when you think about organic, what we want you to think about is, first of all, can your budget afford it? Secondly, whatever you get, it is really good to wash the vegetables and fruits thoroughly. Some of the best kinds of organic to eat are listed here. So strawberries, apples, grapes, any of these items listed on here are best sources of organic. And so as far as eating the right amount, you really want to make half of your plate vegetables and fruit to get that fiber. And this is the way we would suggest that you eat prior to pregnancy and during pregnancy. Like Dr. Davis said, we're not trying to eat large volumes of food throughout the pregnancy. Really, your needs increase a little bit as each trimester goes on. So that rule of the palm of the hand, not counting your fingers, is a very good suggestion for protein. Half of your plate being those vegetables and fruits, and then try to get the whole grains, brown rice instead of white rice, whole wheat pasta instead of white pasta, and try to include that source of dairy at your meal. Daily.
Okay, great. Thanks, Mary. So we'll talk a little bit more about how our body changes during pregnancy. So we have a lot more blood volume. We also start to breathe more quickly and have a faster heart rate and increased blood sugar. And all of that is meant to help to get more blood flow, oxygen, and nutrients to baby. And so this is just a visual to see what percentage our body composition is with the amount of blood before pregnancy and during pregnancy. So there's about a 50% increase in our blood volume to where it's typically about 7 liters of blood during pregnancy. We also have a higher baseline blood sugar that our body typically will have. Insulin is the hormone that helps to store blood sugar, but pregnancy hormones make insulin, not work as efficiently. And from baby's standpoint, that they want all of those nutrients and sugar to help them to grow, but it's always this balancing act. And so all women can be at an increased risk of developing things like gestational diabetes with just how our body naturally works in pregnancy, that we all have increased insulin resistance, so to speak, that the insulin levels don't work, the insulin function does not work as well in pregnancy versus outside of pregnancy. So all women should be screened for things like diabetes in pregnancy. And so things that we should know about why is it important to screen for that is because if we do develop gestational diabetes, knowing first of all, it is something that we can control with things like diet and medications if need be. But if it's undiagnosed and not taken care of, then it can lead to things like complications in pregnancy, such as a baby that's too large, increased risk of C-section, or a higher degree of vaginal tearing, more blood loss during pregnancy, babies that might need intensive care services or in severe conditions could lead to things like stillbirth. So that's why that's part of our routine prenatal testing. And that's typically done between 24 to 28 weeks of gestational age in pregnancy. And I'll turn it back to Mary for how we can eat with for healthy blood sugar in pregnancy.
And so I think one of the things is going back to that idea of whole grains. We do know that carbohydrates turn into glucose or sugar in the body. Eating a lot of carbs at one time can raise blood sugar levels. This typically happens in someone whose pancreas is not quite working the way it should all the time. But the type and amount of carbohydrate that you eat can really impact your blood sugar levels. So when you choose to eat carbohydrates, you want to choose to use those whole grains. So brown rice instead of white rice, whole wheat pasta instead of white pasta, whole wheat bread, and many benefits. It will help keep you full, it will help with regularity, and it will help promote a normalized glucose. And I think to have a good blood sugar, try to eat on a regular basis. Try not to go more than 5 hours without eating. Try to have a balanced diet where you have protein, fat, and some carbohydrates. Particularly for anyone who's had a history of gestational diabetes, and everyone in here, juices, sweets, sodas, they do not give you nutritional value. They don't give you the vitamins. They don't give you the minerals that your baby needs. So watch how much of that you eat. Same thing with baked goods and high fat snacks. That's just a good rule in general for anyone in our group today.
Great. And so we'll talk about how changes in diet can help to alleviate some common symptoms in pregnancy. So things like nausea in pregnancy, we want to eat small, frequent meals can be helpful. A lot of times if we have a low blood sugar level, that can make us feel more nauseous. So I tell patients typically trying to aim for at least 3 small meals throughout the day, and then at least 2 to 3 snacks throughout the day. We can add things like peppermint or ginger candies or tea to help with symptoms, and then adding a vitamin B6 supplement after talking to our doctor. There are other prescription medications for more severe cases, but this is just a first line interventions that can be helpful. Things for constipation, definitely increasing our fluid intake. We should be getting at least 8 to 10 glasses of water per day during pregnancy, and then really increasing our fiber intake, as Mary had told us. For heartburn, which is a very common pregnancy symptom, it's because of all of that extra pressure on the top of the stomach and within the abdomen, and then that progesterone hormone. Things that can be helpful are avoiding really spicy or fatty foods can be triggers. Also, carbonated beverages is another trigger. And try to chew gum can help produce with more saliva production and naturally help with heartburn. Again, there's other over-the-counter medications and prescription medications for patients who need them, and that can be discussed with your OB provider. And then we just have a list of our nutrition services. So if anybody is interested in meeting with one of our nutritionists and talking about what else they can do from a dietary standpoint to help to improve health during pregnancy, would encourage you to be able to reach out to one of our nutritionists. We also do offer a health coach service through the University of Delaware. This is a free service. All of our OB providers through Christiana should be aware of this service, but there's the contact information here if anybody in particular would like to be able to use a health coach during pregnancy. And then we have a list of our references, and without further ado, we will get to our food demonstration that we have Dorothy here from Vetri Community Partnership. Let me make sure, Dorothy, I'm going to put you on the spotlight.
Great.
Great.
Bye, Nancy. I just saw your chat. Oh, I think she just popped off. She said she had a meeting to get to. Okay. All right, so I'm on my screen. It says I'm still viewing your screen and your slides are still up.
Let me here. I have one quick information about Vetri itself. I don't know if you want to give us a little background, Dorothy, and then I'll stop sharing.
Great slide, because I was just going to rattle this off verbally. So hi, everyone. Thanks so much for joining. My name is Dorothy. I am a nutrition and culinary educator with Vetri Community Partnership. Just a little bit of background about us as a nonprofit organization. We were founded in 2008 by Chef Mark Vetri, who's very well known in the Philadelphia area, along with another partner of his at the time. And really our overall mission is exactly what it says on the slide. So empowering children and families through family directly partaking in education, as well as the ripple effect of what children learn at community sites and schools with us and what they bring home, and they themselves empower and become the educators to their own families, to be leading healthier lives through fresh food, tactile, hands-on experience with knife skills, cooking skills, kitchen safety, learning dry versus wet measurements, everything you can think of in the kitchen that happens in our classroom learning environments. So it's a lot of fresh food, plant-based exposure. We'll do anywhere from 4, 6 to 8 week, sometimes even 10-week curriculums, and we will use minimal dairy, minimal eggs, minimal animal protein, but it's really all about exposure to fresh fruits and vegetables, as well as whole grains. Children trying raw vegetables that they've never eaten before for the first time. You kind of catch them eating a red bell pepper and they're like, am I allowed to try this? And we're like, absolutely. And then also let me know what you think once it's sauteed and cooked in a stir fry. So that magic and those light bulb moments happening right there in the classroom within the span of 1.5 to 2 hours is truly a really rewarding experience to behold. And again, all of our education is really STEAM focused. And so we're infusing what children are learning in the classroom directly into our recipe education, from reading comprehension and literacy to math skills and everything in between. So that's a little bit about us. And without any further ado, I'm happy to transition to our recipe today. I know we're still a little early. It's only a little after 12:30. I had my eye on the time. And so I'll still try to keep it really short and sweet, about 15 minutes. And then if there's any culinary, nutrition related questions, I'm happy to field those. You can always reach us after if something comes back to you. And nobody's mad about getting a few minutes back from their lunch hour. So with that being said, the recipe that I'm going to be throwing together really quickly for you all today is our rainbow farro salad. So one thing that's really great about this recipe, there's many great things, but one thing that's really, really great is that pretty much every single ingredient that we're listing here is full of baby building ingredients and nutrients. So it is super pregnancy friendly, and anything that we might be wondering about, especially because this is a cold salad that uses raw vegetables. We know and understand now, especially after watching this wonderful presentation, just how much it is important to continue to wash and thoroughly rinse and clean any fresh produce, fruits and vegetables and everything that enters our kitchen. So that, should go without being said, but I just wanted to reinforce that because it's so important for this population. So we're just going to dive right in, and I'm just going to angle my camera down a little bit so you can see my cutting board and my workstation area. And so the very first thing that we're starting off with is a pre-cooked, about 1 cup. You, of course, can customize this to be a little bit less or a little bit more, but we're using an ancient whole grain called farro. So technically farro does contain wheat. If you couldn't access farro in the grocery store aisle, there are a lot of really suitable substitutions out there for this recipe. You could use bulgur wheat. You could also use couscous, both of which also contain wheat. If you have a gluten-free household, you'd like a gluten-free alternative, you could easily use quinoa, buckwheat, which is a misnomer, even though wheat is in the name, it's technically a gluten-free grain, amaranth, or even a seasoned rice. So I've already pre-cooked this farro. I'm just going to hold it up to the camera so you can see. It is always best to follow the package instructions. I know we included a specific instruction for this in terms of the water to grain ratio, but one of the beautiful things I love about farro is that it's a very forgiving grain. It's actually just as easy to cook as pasta. And so let's say you added a little bit more water. If you're feeling a little intimidated by cooking a new grain in the kitchen, but you're curious about it, just know that if you were to add a little bit of extra water, you can drain it off just the same as you would for pasta, and all is not lost. So again, there's a little bit of forgiveness in cooking this new whole grain. It's got a wonderful fluffy texture. So it's a little toothsome, and it's got this also kind of mildly sweet and nutty flavor. And so because this is a cold salad today, this is pre-cooked. It's been chilling and hanging out in my refrigerator. We're going to come back to the farro in the end. But before we transfer from the farro, I just want to highlight a couple nutrient highlights for this. So even in 1/2 cup of prepared farro, or 1/4 cup dry, which turns into roughly 1/2 cup cooked, it packs a really good nutrient punch, especially for our pregnancy nutrients that we want to be focusing on. So it has, in 1/2 cup prepared, it's got about 5 grams of fiber, which is really, really wonderful to put that towards our daily goals. And it also contains 6 grams of plant-based protein. And that's the same or equivalent as about 1 egg. So even this 1/2 cup of this prepared whole grain, it's not just about the micronutrient profile of the vitamins and minerals, it's also got these macronutrients of the fiber and the protein going for it as well. Super important. All right, so the next thing we're going to transfer over to is our vinaigrette for this recipe. So this is just a really nice Dijon honey white wine vinegar, lemony vinaigrette. So that brightness, the acidity from the lemon is really going to help balance out the flavor once we get going on our greens. And so in the bowl here, we already have our mustard, our honey, the white wine vinegar, as well as a little bit of seasoning from dried oregano in the pantry, salt and pepper. So the only thing that's left for us to do is grab our handy dandy microplane. If you don't have one of these, I mean, I will just put a personal plug and endorsement in. This is probably one of my most used kitchen utensils. If I had to say there's a top 10, this would definitely make the list. If you're a citrus loving person, the zest of citrus, whether it's orange, limes, or lemons, is so valuable, and it adds such a kick to our meals and such a brightness. So you could absolutely use perhaps something more common in a lot of kitchen households, which would be a box grater. You can technically use this to zest, but I will say it gets caught all up in the inside. It can be, just a little bit more tedious to get out. So not to dissuade anyone from using that, but this is just a lot more comfortable. It's a lot more direct, and I find it a lot easier. So what we're going to do is we're going to use our microplane, and we're just going to quickly zest this entire lemon. And when you're zesting, if you're new to this, you really don't go down all that far. I'm applying a really light amount of pressure to this lemon, because once you get down into the really, really white pith of any citrus, including this lemon, that's where the bitter notes and the bitter compounds start to come in. So I don't know if you've ever had a key lime pie or a lemon meringue pie that just was a little bit off, or maybe you noted some bitterness to it. Chances are the zest that went into that recipe dug way too deep into that citrus, and it included some of that bitter pith. And so also we want to be mindful of taste aversions too, right? Especially during pregnancy, that can creep up. And so you'll see from this zested lemon, it's still got this nice light yellow hue. So we haven't gone down too far into the pith, but we've got all of this beautiful bright lemon zest. It's going to go right into our vinaigrette. going to half this lemon here. And this recipe, we're only calling for 1/2 of a lemon. If you do not have a citrus press at home, another favorite kitchen tool, you can absolutely just use a fork to squeeze it, or perhaps you have a different form of a citrus juicer, but the citrus press here works just as well. So we're going to go ahead and just squeeze in that fresh lemon juice. And then last but not least, we're going to add our olive oil. So talk about healthy fats. We definitely heard a lot about the healthy fat contributions from seafood and from different types of fish. We also have nuts and seeds. Avocados are great healthy fat sources, but also we shouldn't overlook olive oil because it's so easy to use. We can use it for breakfast, lunch, dinner, even snacks and appetizers. It's just another great vehicle to get some healthy fats into our diet, especially during our pregnancy months. So what we're going to do is we're just going to slowly whisk in. This is about a 1/4 cup or 4 tablespoons of extra virgin olive oil. And we're just going to whisk this in to incorporate in our dressing. And it's creating, a semi-permanent emulsion. It's not as emulsified or thick as something like a mayonnaise, which is a true fixed emulsion vinaigrette. But the honey and the mustard in this salad dressing act as stabilizers. So it's going to give this dressing a really nice body. And I just had it in that tiny bottle just for demo purposes and just to show you, but full confession, if I'm making this on my own, I might not even use a whisk. So if you don't feel like breaking this out, you can by all means just make this with a fork for a little low maintenance salad dressing. You can even throw all of these ingredients into a glass jar and then simply shake it up, and it'll keep for the better part of a week. And while it is the vinaigrette for our recipe today, I will say that the flavor profile of this vinaigrette is very versatile. This could be on another salad. This could go really beautifully with chicken, with fish, even with some vegetables, some roasted vegetables. So the salad dressing is not exclusive to this recipe. It can really work in a lot of different arenas in the kitchen. All right, so now that we've got our dressing all set, our farro is all set, we're going to move on to the star of this recipe, which is our rainbow chard. So I've got some fresh rainbow chard here. And a fun fact about rainbow chard is that it's actually not a true varietal, as the name might imply or suggest, but it's actually, it's just a combination of different types of chard all coming together. So it's really white stemmed Swiss chard, a red chard, and a golden chard. And so you'll see if you look at the stems, we've got this nice combination of all of those different types that come together into this bundle, and we buy it under the name of rainbow chard. So when you are purchasing and looking for buying rainbow chard in the grocery store, big, bright, and vibrant, those are the adjectives that you want to look for. You want to look for big, bright leaves, nothing wilted. You want to look for bright and vibrant colors in these stalks. You don't want to look for, if you see any browning, then you want to avoid that. It's probably not as fresh and it's not going to taste as lovely. And storage for these is going to be best in about 2 to 4 days in refrigeration. There are certain greens, like kale, for instance, is very hardy. That could last, 1 week, even stretching into the 2-week area if you store it properly. For something like kale, that's got some long legs in the refrigerator. But with Swiss chard or rainbow chard, we really want to use it up and have it be as fresh as possible. And so in terms of preparing this, we're just going to take our chef's knife, and it's really like 2 vegetables in one, because we've got this really nice stalk or stem, sort of reminds you of a celery or a rhubarb. So you can just thinly slice those, and we'll just place these back into the bowl. And what you want to do with the leafy section is just fold it over onto itself, just like so. And then we're just going to work our way across the leaves and thinly slice them, kind of tucking our fingers out of the way. And so what we're left with are these really beautiful chard ribbons. Really similar technique to if you ever have heard of chiffonade for basil or another type of green where it's sliced into really thin ribbons. It's the same kind of technique. So let's talk a little bit about the flavor profile of Chard for a moment. It definitely is an assertive and a bolder and, dare I say, slightly bitter flavor profile. Now, that type of green, whether it's collards, for instance, that's a really well-known slightly more bitter green. If we braise those down or cook those down, it tends to make them less aggressive or slightly less bitter. And so that's something to consider for this recipe, because the way that we're preparing this is, again, like I said, everything has been very well washed and cleaned to avoid and reduce the risk of any foodborne illness, bacteria entering the kitchen. But if the bitter greens is just not your style, then this recipe will work just as well by cooking up and sauteing these greens. So that would just be, an extra 3 to 5 minute step, a little bit of olive oil in the pan on low to medium heat. And then we would be able to cut that bitterness a little bit. But what's going to help out balancing the flavor of this is not only the fat from the olive oil, you could also add something like a goat cheese. Of course, if it's pasteurized, we want to check the label for that. You could also tone it down a little bit with just a smidge of extra honey in your dressing for some more sweetness. Or, of course, we want to remember that there is lemon going into this. And so that bright acidity is also going to help balance all of these flavors that are coming together. And Swiss Chard, Rainbow Chard, it absolutely packs a really great nutrition punch. Just like I mentioned before, every single ingredient that we're touching on are baby building block ingredients. And so this in particular is super high in fiber. It also contains vitamin E, which even though it's a vitamin, it's a fat soluble vitamin. And so the olive oil in the dressing is going to help our bodies obtain the vitamin E from these leaves better. And it's also got vitamin K. And so that's really, really important, not only for maternal and baby bone health, but also for our blood clotting and our blood formation as well as a host of lots of other minerals. Those are just some of the key ones that we want to highlight. So what we're going to do now is we're going to bring all of this together and assemble our salad. So what's already been prepared for this cold veg salad is we've got some minced shallot in here. Shallot is got a little bit of a bite to it, but it's also got a mild sweetness to it. If you don't have shallot on hand, using a sweet onion, anything like that, and mincing that up, or at least a very small dice, would work just as well. So do not fret if you don't have shallot. We've also got some nice summery yellow zucchini squash in here as well. Now, for me, when it comes to the zucchini noodle phenomenon with the zoodles, those are technically eaten raw. And so I do just want to point that out here as well. Customizability, individualize it. If you really love the flavor of those raw zoodle noodles, then this would be a great salad for you as is. Again, if you're really craving more of a warm salad, you could absolutely saute the zucchini along with our orange bell pepper here for even just a few minutes to cut back on that raw flavor and have it as a slightly sauteed, slightly cooked and minimal olive oil salad. That would work just as well. Awesome nutrients going on in here as well. We've got these bell peppers are packed with provitamin A as well as vitamin C. So we've got a lot of antioxidants going on in here and fiber as well. That's really across the board for any vegetable that we're going to incorporate. So what we're going to do is we're just going to go ahead and add our beautifully trimmed ribbons of our rainbow chard. And we're going to go ahead with our cooked farro and add this in. And this is a great grain. I didn't mention this before, but this is a really great grain to batch cook because this does not just have to go into salads. This could be something to make a soup a little heartier. This could be a grain bowl with a protein, other roasted vegetables and some cheese and a dressing. That's a really popular dinner in my household, especially with farro as the base. And you can also jazz it up with a little bit of lemon zest and season it. And that could be another nice alternative to a side to protein. So we're not just eating chicken with potatoes or rice. We could really switch it up and get a different nutrient profile. And then we're going to incorporate our dressing here, coat everything, give that a good stir. So this will keep really well as leftovers, especially for a couple of days. All of the flavors will really begin to meld and marry together. And because we're on the lunch hour, I will say that this makes a really, really terrific lunch. All right, so last but not least, our final ingredient for the rainbow farro salad is about 1/4 cup of some slivered almonds. So just a note on toasting these, as our recipe calls for an option to toast them. All you would want to do for that, especially a small amount, is just a small saute or frying pan. You don't need any oil in the pan. And you would just go ahead and agitate these nuts on high heat until you start to see some white smoke and until you start to see the color change. Just make sure, if you're going to toast nuts in your house, because you don't have to buy them toasted, you can do it yourself with a few extra minutes of time on hand. Just make sure that you have a plate or a bowl next to your cooktop so that when those nuts are toasted, you can easily and quickly transfer them, because they can burn on you very quickly if you don't get them out of that hot cooking vessel. So I left my almonds just as they are, untoasted here. And these are also a great nutrient trifecta. So nuts are packing the punch of fiber, plant-based protein, and also healthy fats, in addition to a beautiful array of other minerals. I'm going to keep my nuts on the side. My husband has a tree nut allergy, so I will put these in my own portion as opposed to mixing them into the family lunch bowl. But that is our rainbow farro salad. It is chock full, like I said, of baby building ingredients. This is a very, very blood sugar friendly, blood sugar stabilizing recipe. And it's also completely customizable. So whether it's swapping out a different grain, if the rainbow chard is not for you, this could easily be spinach or arugula. That could be prepackaged, and there's no prep or thinly slicing necessary. And the vinaigrette can keep up to the week as well. So really, you don't have to dress it all at once. You can use it for other things and apply it as you go throughout your week with your meal prep.
That looks wonderful. Thank you so much, Dorothy.
You are so welcome.
I need to go home and make it.
With you, right? So you have it by email, or if not, I'd be happy to distribute it to you again so that you can share it out with anyone who might be interested.
Thank you. Yes, and so we'll get out the PowerPoint presentation and then also resend the recipe as well, so that all of our participants have that. And
Great.
then if anybody has any questions, feel free to ask.